And thank you, Ranking Member Brownlee. I now recognize Dr. Murphy for 5 minutes for any questions you may have.
Thank you, Madam Chairman, and thank each of you for your service and the work that you're doing to try to make our care for our veterans as best as possible, regardless of where it comes from. I wish this was not an either-or kind of situation. This needs to be an yes and situation, because the VA cannot handle all the health care that it needs to handle for our veterans, period. There are not the resources, some of which is negligence on the behalf of the medical education system of the United States. We simply don't have the doctors. We simply don't have the doctors. But it just kind of hurts me that people want to say this is better, that is better, and against one care or the other. So, Dr. Hunter, since you brought it up, you don't mind, I'm going to ask you about your ocular melanoma. So, are you saying that the VA doctor picked that up because they knew you might be exposed to something, or are you saying your optometrist out in the community missed it?
I had an appointment with an optometrist out in the community who did miss it. 6 months later, I had an appointment with an optometrist at the VA who was able to recognize it.
So did the optometrist do an ocular examination? Did it look in your eye and look all around your quadrants?
Yes.
Did you by any chance get films from them before then? Because they always make films. Ocular melanomas can happen in 6 months.
Yes, there were films. It was present in the films when my VA provider had reviewed them later on, and it wasn't discussed or addressed.
So I would just submit that that's a difference between two physicians. It doesn't matter where they're coming from. Whether you could flip them the other way itself to say one is better just because of the place where they work, I think is just not being correct. Also, delving into some of your comments about post-operative care, can you give me a breakdown of the type of patients that are referred out to community care for surgery versus those that are kept in-house?
I can take that question for the record and get you the breakdown.
I can tell you what it is. You don't refer things out to the VA unless it's specialty care. I'm a specialty surgeon. I get specialty referrals for specialty care that cannot be happened within the hospital. By definition, those are more costly because they're more time effective, they're more specialty oriented, and their risk rates are higher. So doing actually a risk ratio would be factual to this rather than just saying post-operative care is better at the VA, the outcomes are better than they are in the community, because they're two entirely different populations. You refer people out who need specialty care, who by definition have greater needs than they do. I just don't like the tenor that we're battling against, saying that the community care doctors, of which I am one, are better. Are worse. I don't think that's fair. That's not fair to our veterans. Then what are you saying to them? Anybody who gets referred out, well, we're sending you out for inferior care? That's not fair. I don't think that is fair. Ms. Knight, let me ask you this, and there are questions about, which has bothered me since I've been on this committee, about our electronic medical record, which I think is just derelict in the VA through how many administrations that we've been going through. I still can't. I had a patient last week who was a VA, and I said, did you bring your records? And he said, no, they said you'd have them. Of course, they never sent them, and I can't get access to them. Can you explain to me how just the community care has helped you to access more or less, given you more or less access to VA-covered health care?
I have more options. I live in Montana, the biggest city in Montana at 150,000 people, so it's quite small, actually. And there are not a lot of providers, let alone specialty providers from within the VA. I see a chiropractor and an acupuncturist to help with my chronic migraines, of which neither are available within the VA. And as I've shared in my testimony, I've had pretty horrid stories and experiences within the VA and good experiences within the community. My chiropractor, who is a male, actually took the time to review what information was passed to him from the VA with my referral and asked me on my preference on whether or not I wanted a man or a woman physician, which was the first time I've ever been asked as a proactive manner on my preference given my military sexual trauma.
So they're good experiences or bad experiences really probably within both systems?
Absolutely. I would ask to just have more control and choice over where I want to go. As I also mentioned in my testimony, most times the gatekeeper within the VA calls and says, here's your list of providers, where do you want to go? And I feel like I'm on this ticking time bomb of making a decision while, momentarily taking a time out of my workplace, because it's usually Monday through Friday, 9 to 5. And in that effort, my typical question is, well, what's closest to me as a convenience for me? Not necessarily, are they man, are they woman, do they have good reviews, can I do research on them? I would ask to better understand what my options are so that I can make a more informed and educated decision for myself.
Oh, thank you. You know, Dr. Mobbs, it hurt my heart to hear that somebody in administration would withhold care because they wouldn't have the compassion, much less the medical competence to send somebody out to the community and withhold care. I hope that person, I don't want to say disciplined, I hope they got shown the door, because what an absolute disservice it would be to whoever veteran, sadly enough, if they die in pain because they didn't get their radiation. That's horrible. That is a horrible story. Ms. Keenan, in your opinion, if you will, where does community care fit in? Am I already over? I'm sorry, I've been yakking too much. I apologize. I'll yield back.